Agent administration. It's easy to dose. It's 1-to-1 cartridge ratio to local anesthetic with a vasoconstrictor. You do have a maximum recommended dose of 2 cartridges for adults and adolescents 12 years of age and older. 1 cartridge for patients 6 to 11 years of age and over 66 pounds, and half a cartridge for children 6 years of age or older weighing 33 to 66 pounds. Oraverse is not recommended for use in children less than 6 years of age and weighing less than 33 pounds. There has been a clinical trial that's ongoing now for the last couple of years looking at ages, I think, 3 to 6. The last I was informed was that this was coming to an end and they were in the data collection and analysis period. So hopefully we will see that within the next year to 2 years we'll actually have information on what can be used in kids that are 3 to 6, because that is a population where you could see even more benefit with using this particular agent. Use a standard dental cartridge. It's designed the same way. There's no difference between that cartridge and the other ones that we have in the office. Use the same injection site, same technique as your local anesthetic, and I always like to talk about needle usage. I am one who believes that you use a new needle every time you go through, and obviously that'll decrease post-injection pain. If you're using the same needle that you use the injection for, you increase the chances of post-operative injection pain because you're using a needle that has already been dulled. And if you're not using a good needle, which is another webinar that'll be coming up in a couple of weeks, if you're not using a good needle, then there can be some detrimental effects to the tissue. Oraverse should be administered following the dental procedures, how it's the technique that's recommended, using the same location infiltration. However, and this is how I use it, this is not on the package insert, this would be outside of the realm of what they're suggesting. There has been some anecdotal evidence by Burgess and Yagella that maybe after you prepare the tooth, that once you're ready to fill, it would be a good time to actually administer the Oraverse. Some people use half the dose for the maxillary infiltration, and we've talked about the needle use that's been recommended. These are all anecdotal, just some things that are out there clinical wise.